facilities not only are at their end of useful life, but have also are not meeting the functional needs for these departments, and both departments have outgrown space in these facilities. This particular project has a bit of a storied history, so over the next few slides, I'll be recapping the direction and decisions that have been made to date to inform where we are today with this project. The original project was approved as part of the 2020 budget in August of 2019. That original scope was anticipated to be around 120,000 square feet and was envisioned to be an integrated health facility, bringing together both mental health and public health into one facility. And it was planned to be on existing county-owned property on the Sunset campus. That project, however, did not move forward with design and construction and instead was paused in March of 2020 when the organization's priorities shifted dramatically due to the COVID pandemic. At that same time, New Century office building was being vacated by longtime tenant CenturyLink. And in October of 2020, the board directed staff to explore how we might be able to use New Century office building to offset some of our anticipated space needs and new construction projects like the new health services building. And to do that, the board also directed staff to provide a major update for the strategic facilities master plan. That effort took a little over a year, and in March of 2022, the board, after understanding the information and the options presented, directed staff to move forward with capital planning strategies that did not include New Century office building. That effectively put us back on track to pursue new construction for this project. And as part of the 2023 budget, we requested funding to conduct a pre-design phase for the project, knowing that a lot of time had passed since the project was originally in the budget in 2020. And then at that same time, we put a placeholder in the 24 budget for the design and construction portion of this project. And as part of the budget hearings this past year, verbally clarified that we would likely be back before you to update the budget and project scope as a result of this study that we've been conducting over the past 5 months. The pre-design study has been a very collaborative and thorough effort. This is the first time that we're bringing together department and staff from all departments that will be occupying the building to inform a detailed space program. That step had not been done previously before the submittal for the 2020 budget, so this is really our first opportunity to have a really informed space program for this project. The effort included 5 multi-day workshops with the project planning core team, and that core team included staff from mental health, Department of Health and Environment, Aging and Human Services, and Facilities Management. We also engaged subject matter experts and advisors across the organization and included over 60 staff in this effort, including department director leadership and county manager's office leadership. And this effort was led by our consulting team. Finkel & Williams here locally out of Lenexa is partnering with Perkins & Will, an international firm, on this project. And they not only bring incredible expertise from a architecture and design perspective, but also from a behavioral and public health perspective. They've brought subject matter experts in those areas as well. So we feel this process was incredibly informed and just wrapped up here in October. And with that, I will turn over to John Garr of Finkel & Williams, and he's going to walk us through a little bit more detail of what that pre-design process looked like.
Thank you, Lydia. Mr. Chairman, members of the Commission. The study process included 5 workshops and 2 leadership meetings over about a 5-month period. We engaged in virtual tours of similar facilities, engaged in organizational mapping activities similar to the image you see there in the lower left-hand corner. We learned about all of the operations of the departments, visited their facilities, and documented those findings. We collaborated with each of the departments individually and in groups to identify synergies of each of the organization and understand how they might commingle. Through that process, we discovered challenges. At the same time, we discovered efficiencies. And then in the end, we came up with a recommendation, and we We challenged the space requirements and the requests, the quantities of space that were necessary. We offered benchmarks for national benchmarks for facilities throughout the United States, including Mayo, Kaiser Permanente, and UC Gardner. This slide here represents kind of early on in the process. We, as a group and a whole committee, established goals. This really is an opportunity for us to kind of check ourselves along the way as we continue into the design process and decisions are being made. If there's any question marks, we can always come back to this and make sure that what we're doing is meeting those core project goals.
Well, good afternoon. My name is Jerry Johnson with Perkins & Will. During the pre-design workshops, we developed an efficient program of space requirements for a new health services building at the Sunset Campus. The building will be approximately 150,000 square feet and addresses the current functional needs as well as future growth. The program can be summarized into 5 categories as shown in the pie chart. The first is public areas, include lobby, check-in stations, welcome desk, and meeting rooms. Building services include receiving docks, storage for all 3 departments, custodial and building support spaces. But the heart of the program really is the 3 main departments. Aging and human services include volunteer spaces, a commercial kitchen, and storage. Mental health includes clinic modules for adults, children, family services, mobile crises, medical services, operations and prevention, and transportation services. And the last department is health and environment, with clinic modules for health services, immunizations, the Women and Infants and Children's Program, the WIC, environmental, child care licensing, emergency response, epidemiology, and community health. You'll note that the lab, pharmacy, staff support, client programs, transportation, administration, and operation spaces can be shared. This allowed square footage reductions gained by having all 3 departments collated in one location. During the workshops, participants uncovered ways to find space efficiencies. Teams worked collaboratively to discover ways to share space, as the previous slide showed, and make space more flexible and adaptable to future changes. From the first draft of the program, the bar on the left, to the final document, the bar on the right, the total square footage reduced by 25%. Participants found opportunities to make the building smaller by sharing spaces and using space in smart ways. The pre-design process netted immense value in support of the project goals that John mentioned. There are proven benefits to an integrated health facility. The new health services building program was envisioned through the lens of Public Health 3.0, which is an initiative created in part by the Centers of Disease Control. Public Health 3.0 calls for a new era of enhanced public health that focuses on collaboration across departments to encourage innovative strategies for care. The goal of this initiative is to promote overall well-being and support preventative measures. Emphasis is on early intervention and value-based treatment. Johnson County's vision of integrating the services provided by the Departments of Aging and Human Services, Health and Environment, and Mental Health within one facility sets the stage to meet the expectations of Public Health 3.0. Having these key services in one geographical location working collaboratively improves patient outcomes, improves safety, and reduces the community burden of illness. This building will be a one-stop shop, improving access to health services and prevention. Beyond the benefits of improving services, co-location allows 30% of the square footage to be shared. During the pre-design study, participants uncovered opportunities to standardize spaces and share resources, improving both space and operational efficiencies.
Thank you for that summary, Jerry. So when we look back to when the project was first put into the budget in 2020, that means that staff were actually gathering information to inform that submittal in 2018 and 2019. So it's important for us to pause and understand what has changed in that time period. And when we look at both of these main departments that will be occupied in this facility, at a high level, we see quite a bit of growth. And as we know, mental health has been growing significantly over those past 5 years. And as a whole, the department has grown 42% since 2018. Over the next few slides, we've invited the department directors to join our presentation today to talk in more detail about what has changed with their services and where they see the futures of their departments and how the building might help address some of those future challenges. So we'll start with Tim DeWeese, Director of Mental Health.
Thank you. So Tim DeWeese, Mental Health Center. Actually, with regard to our growth, you all should be very familiar with the 2 points on this slide. The first is with the CCBHC, which we discussed at length last week. So I don't know that I need to really provide you any more information about that. But it also focuses on what we have referred to as the Johnson County Community Crisis Continuum, which I think we had a study session earlier this year about. And it's best practice for us to intervene, for instance, with people before they actually go to jail, before they are in the emergency room or emergency department, or before they actually are admitted to the hospital. To give you just one statistic that we keep an eye on, 43,221, we had that many crisis contacts in 2022. And in 2023, by the end of this year, we'll be well over 60,000 crisis contacts. So as we continue to develop that crisis continuum and divert individuals from other services, we'll continue to see those things grow. The other point that I want to make is that this building is just one of 3 facilities, 3 clinics that the Mental Health Center has. So when we talk about growth of the Mental Health Center, this will just be the growth that we expect from the Olathe area. And I think the next slide can demonstrate that. So on the left, you'll see a heat map of all of the kids that we serve. And then on the right, you'll see all of the adults that we currently serve. And this has been just updated for 2023. So on the graph on the right, you'll notice that the 2 light-colored blue dots are our Mission and Shawnee offices. And they will continue to see growth. But I think as we build this building, we'll be able to shift things to be able to maximize clinical space in all 3. And then we'll also need to begin to talk, and I know I've mentioned this before, begin to look at the Gardner area, because it is an area that we need to focus on providing services locally there in the Gardner area. And with that, I'll turn it over to Charlie.
Thank you, Tim. Good afternoon, Commissioners. Charlie Hunt with the Department of Health and Environment. And I'll just begin by stating, the core function of public health is to provide assurance. And for us, that means providing equitable access to health and related support services. An important way that we do that assurance is through our clinical preventive services, such as immunizations, family planning, women's and men's health services, and our prenatal care program, as well as other programs such as the Women, Infants, and Children program that was mentioned earlier. And through these programs, we serve a substantial number of members in the community. For example, in 2022, we served more than 18,400 clients through our clinical and immunization program services. And as you can see from this heat map of the clinical services provided over the past 2 years, that Olathe Clinic site really does provide a central location for a high percentage of the clients that come into our clinics. In addition to the clinical services, our WIC program served approximately 7,600 clients in 2022. And between the existing health services building and the Sunset Drive office building, which is right next door, the Olathe is really the home to our administrative offices, as well as most of the other programs which provide a broad range of other public health and environmental services to the communities. And of course, we're also in close proximity to the medical examiner's office and the Office of Medical Director for Emergency Medical Services, which is right across the street. And these locations enable us to have better collaboration within the department, which is really important to us. Next slide, please. But I think it's also important to note that much of what determines our health happens outside of the healthcare setting. And as Jerry mentioned earlier, we've been working to advance Public Health 3.0, which includes strategies to engage partners across multiple sectors in the community and to leverage data and resources to address the social, environmental, and economic conditions that impact our health. And so for us, this means that in addition to the direct services that we provide in our clinics, we're also working to conduct more outreach in the community and with other organizations in the community. For example, our community health worker program, which has developed over the past 3 years, works to strengthen the relationships with other organizations in the region and to build more effective referral networks for the clients that we serve. And then more recently, we've developed new coalitions such as the Public Health Leadership Council, the Johnson County Child Care Coalition, and the Sustainability Coalition, which met just for the first time last evening. And we'll continue to strengthen the existing partnerships such as the Community Health Network, our Safe Kids Coalition, a Food Policy Council, and even our Solid Waste Management Committee, among others. And so in closing, in order for us to do this work effectively, we need to have a building that is warm and inviting to our clients, as well as one that offers opportunities for more collaboration with our partners, having the flexible meeting space and the appropriate technology to do this work effectively. With that, I'll turn things over to Tim Wolf. Thank you.
Good afternoon. Tim Wolf, Aging and Human Services. So with the eventual demolition of the current health services building in Evergreen, our central kitchen will be displaced. And currently, our kitchen prepares between 750 to 1,200 meals per day that goes out to our individuals that receive home-delivered meals as well as our congregate meals. The kitchen staff do everything from prepping the meal, cooking the meal, making sure that they're all individually sealed, and then placed in Canberra so they can be distributed across the city, and making sure that we are meeting the temperature requirements for all of our meals. So our central location where we're at now is very, very important due to that process of being extremely time and temperature sensitive. One of the things that we have to look at whenever we're looking at our population is what is that population growth that's expected to take place. And the expected population growth for the 60-plus population is expected to grow about 41% between now and the year 2030. So that's a pretty significant increase. And when you think about that population growth, we also realize that that population is going to continue to need services, and many of those individuals will probably need our home-delivered meal and our congregate services. And so we are anticipating that now and planning for that in the future. With having the central kitchen located in the new health services building, I think it's very, very important due to the opportunities that we have, not only with the growth that it's going to help us provide the meals to the individuals, but also it is the partnership opportunities that are forthcoming. One of the areas, we have a congregate site now in Olathe at Olathe Towers, but we believe that we're going to potentially need another congregate site. And so the way that this kitchen has been planned kind of in the pre-design phase is we could potentially have a congregate site there. The other thing is we're getting ready to partner at the beginning of the year with Shawnee Mission Meals on Wheels because they need help being able to provide their meals. So they're going to partner with us being able to utilize our vendor in our kitchen to provide meals throughout their city. We also have the PACE program that's also in contact with us. And so we know that there's partnership opportunities out there, and having a centralized kitchen that we can provide services for, not just for our residents, but for other partners, could be a revenue generating opportunity. So there have been alternatives that have been explored, as you guys are probably aware of. In 2021, there was a nutrition program kitchen study that was completed. And the result of that, what they really did with that study was look at 3 options for a standalone new constructed kitchen. The first option was having a standalone kitchen as well as a distribution center. The second option were those 2 options, but also included a congregate site. And then the third option were those 3 options plus workspace for nutrition staff. So those have been looked at through a kitchen study. Other partnerships that were looked at, I think the board asked the previous administration to look at different alternatives that we had throughout the county. And so partnerships were looked at with school districts, hospitals, different community organizations that may have standalone kitchens. They also looked at different vendors that provide meal services. And they also toured the New Century office building as part of Lydia mentioned, the 2021 Strategic Facilities Master Plan. And so with all of the alternatives that have been looked at, to date, none of those have presented a workable solution for us. And so that's why it's really important for us to be considered a new kitchen and part of the new health services building.
This is a site plan of the Sunset campus. The new health services building is proposed to be built to the west of the existing Sunset office building. During the third workshop, the participants evaluated the preferred location for the building at this campus. At 2 stories tall with a partial lower level, the building footprint is approximately 70,000 square feet. That footprint is about the same size as the Sunset office building. The parking requirement is 513 spaces inclusive of fleet vehicles. The existing health services building, the commercial kitchen Meals on Wheels program, and the Evergreen Community Facility are shown within the red dashed outline. 3 locations were evaluated for the building site outside the extents of those existing facilities. The first was to the north, or to the east, or to the south. Siting the building to the south was preferred. This location offers ideal adjacency to the Sunset building, and in this location, the building can sit next to the wooded area and offer views of the trees and receive the shade of the trees on the south. This location also allows a shared service area between the 2 buildings, and it preserves the 218-car lot on the north, which therefore accommodates about 40% of the parking demand. 2 drop-offs are planned, one at the main entry at the center of the building and one to the west for children or a drive-through immunization center. No curb cuts to Sunset Drive are anticipated, and the existing inter-campus roads as well as the existing garden can be preserved with this site plan.
So from the program that was developed on the site plan that Jerry just presented, we created a construction scope of work to produce a cost estimate. It used detailed program areas by the type of area as different types of spaces cost and have different rates. We understood the site development planning standpoint, so it's specific to this site in maintaining the operations of the existing facilities so that we can build alongside of that and maintain those operations. We figured a quality of construction similar to the Sunset Drive office building in terms of the interior and the exterior spaces. It is, as Jerry mentioned, expected to be a 2-story building, and then taking advantages of the slope of the site, perhaps a small area that would be a lower level basement area walkout. And the building is set up from a sustainability standpoint to be a high-performance building that can be built upon in the future as so needed.
So as mentioned previously, facilities put a placeholder project in the 2024 budget, and that was approved as part of the 2024 budget. That number is currently $83.5 million, and that was based on, again, information and assuming a project scope of around 120,000 square feet. Since then, the pre-design study has offered new information, and we've been able to capture that program growth and change that we talked about. We're able to capture updated inflation. As we know, the construction industry has been, bless you, particularly volatile over the past few years. And so being able to capture that updated inflation and use a third-party cost estimator to make sure that our costs are as accurate as they can be, as well as just new information and data. As John mentioned, we created a very detailed space program, and that did not exist in 2020 when we were planning for that initial budget request. All of that considered, we are now looking at a revised budget of $113.5 million to account for those increases and changes and new information. And that cost is based on inflation to the midpoint of construction to December of 2025 per the proposed project timeline here. As Jerry mentioned in the site plan, we are anticipating a phased demolition of the existing health services building and a phased move-in for those occupying departments in early 2027. And with that, I'll turn it over to Robin Symes, Director of Budget and Financial Planning, to review the proposed funding plan for this proposed project budget increase.
Robin Symes, the original project cost of $83.5 million equates to $6.8 million of annual debt service in the budget. With the revised project cost of $113.5 million, if we fully bonded that amount, the annual debt service would be approximately $9.3 million. So what we're doing is we're proposing a revised funding plan that includes debt financing of $93.5 million, and then the use of one-time funds for the remaining $20 million. There's an existing $6.8 million budgeted in debt service, and we are proposing to use Public Safety Sales Tax 3 to fund the New Century Adult Detention Center Video Court CIP, and reallocate that debt service programmed for this project of $670,000 for the health services building. The remaining $20 million of one-time funds will come from the countywide support funds and the auxiliary fund that I'll go into detail on the next slide. The current balance of countywide support funds is $22 million. Our proposals use $10 million of those funds for the health services building, which leaves an estimated balance of $12 million. We intend to bring back options for the BOCC to consider in 2024. However, some could be major minor home repair and weatherization, homeless solutions, or other priorities. For the auxiliary fund, in August 2020, just for some history, the board established an auxiliary fund within the general fund for the purpose of providing greater stability to the healthcare fund. This was following 2 years where claims increased 26% after the budget had already been approved, and the healthcare balance dropped significantly below the secured funding levels. These funds are committed, however, they can be reallocated with board approval. The secure funding reserve is included in the healthcare fund, and the additional reserve to achieve full funding, which is the projected maximum claims exposure for 2 years, is included in this auxiliary fund. The current balance in the auxiliary fund is $36 million. The amount for full funding is $26 million, which leaves $10 million that we are proposing to use for the health services building. And then finally, I touched on this, but just to reiterate, the proposal is to use the one-time Public Safety Sales Tax 3 funding for the video court CIP and reallocate that debt service to this project.
Tony Barron with Facilities Management. As noted earlier in the presentation, the project planning team progressed through process overview and established the project goals. The suggestions from the study to co-locate public services among departments and strategically centralized functions meets the goals of being patient and client-centered. The project planning team also made intentional decisions to be fiscally responsible when suggesting to accommodate for growth and future flexibility. By establishing this goal early in the process, it allowed the design team to conceptualize this concept knowing that growth is imminent based upon the needs of our Johnson County constituents. And finally, the suggestion to construct a high-performing, efficient facility to support important community services. This concept affords us the opportunity to meet all of our project goals: patient and client-centered, functionally driven, fiscally responsible, and standards-focused. The presenters today and the project team acknowledge and understand the increase in project scope based upon programming needs, which in turn causes an increase in square footage and costs. With that being said, I have been researching costs from a construction, operation, and personnel perspective. According to the Sustainable Building Technical Manual, over the first 30 years of life of a building, 2% of the cost is attributed to the initial cost of construction, while 6% are related to operations, maintenance, and replacement costs, and the remaining 92% is to personnel costs, such as salaries. By increasing or decreasing the initial construction cost, we are only affecting a very small portion of the expense over the life of the building. Over time, I believe performance-based and financial opportunities lie in the personnel costs. If a high-performing and efficient facility is a pillar to build upon, no pun intended, The results of these enhanced building systems have the potential for a healthier environment for both patients, staff, and a more productive workplace for Johnson County employees. So the next steps that we ask, we have 2 bullet points here. The first one is direction, information, and guidance seeking for us to request BOCC approval and authorization of a project budget increase of $30 million to bring the new total project budget to $113 million, and also to request a PBC approval and adoption of a resolution for the sale of bonds on February 1st, 2024, the originally scheduled PBC meeting. And with that, that concludes our presentation, and with that, we will stand for questions.
Chairman, can I add clarification to this page here?
Go ahead.
The next steps, so is my understanding, I just want to clarify with Tony, saying it slightly different, that if you're ready to proceed, we were looking for staff board to direct staff to bring an action item to the board potentially next week if you're ready, correct?
That is correct, yes.
Yeah, I might as well.
Yeah.
I'm going to have to go on Pepto-Bismol or something here.
Miles to go, guys. Go ahead. Is that it? Okay. Well, first of all, thank you to the entire team for the presentation. A lot of work, a lot of history behind this project already, with various steps to take to not only see this building come to fruition, but how it's going to continue to, or how it's going to serve, and how the departments are going to continue to serve the people of Johnson County. Some of the keyword takeaways that you heard, I think all of our 3 department heads talk about, were collaboration, flexibility, centralized location, partnerships, congregation. And I appreciate the innovation and the thought that's gone behind how we can accomplish many things with one particular facility. And so I appreciate that thought. That innovation and that increase in value does have a fiscal component to it, and obviously is something that we're going to tackle during this conversation and moving forward. But Tony, Mr. Barron, you hit the key point for me when we're talking about the costs of the building. 2%. 2% of the next 30 years is what it's going to cost to actually build the building. 6%, or 3 times as much as its operations and maintenance. Let's not be penny wise and pound foolish when we're considering how we're going to serve the people of Johnson County in these areas that are going to have to continue to grow. We've seen growth in the Department of Health and Environment. We've seen growth in the Mental Health Department. We have seen and are going to continue to see growth in the Aging and Human Services. So we need to think about legacy when we're talking about this building, and really create a space that's going to serve Johnson County for decades. And I think we recognize when we don't construct properly, when we don't maintain our buildings, they're not going to stand the test of time. So I appreciate the diligence and the thought that's already gone into this, and look forward to doing our part. Let me open this up to questions from my colleagues on the either project history or the utilization of the building. Let's try to take questions on those first and then go to cost and funding. Is that okay? All right. So history or utilization, Commissioner O'Hara?
Yes, so the current building that's being used on Sunset, I believe that was built in 1997, is that correct?
1996.
Is that correct?
1996.
Okay.
1996.
And when I was first elected, and that was January, or sworn in January 2021, I went out and looked at that building, and it was obvious that maintenance had been absolutely non-existent. And and now we're looking at $113 million, which just quickly, that's $737 a square foot. And this is going to put a huge burden on the taxpayers of Johnson County. And I'll just mention that the juvenile, this is not the only project that we have needs. The juvenile detention center, I'm there every week, and it's abysmal. And we are housing our youth in that facility. So, when we are allocating $113 million, and I will have further questions on the method of financing and explanation on the public safety sales tax. I will have more questions, but I'm really, I really pressed to have some maintenance done on that building 3 years ago, and I mean, I've been out there, I went through it, and there's foundation issues, there's windows leaking, I mean, it's a mess. And then we've also, allocated $23 million to relocate Evergreen. I mean, it's like, this is a money tree that just keeps growing. So, anyway, I have a lot of concerns.
Commissioner Hanslick.
Oh, thank you, Mr. Chair. Just some kind of, I guess, technical questions.
Microphone.
Just some technical questions. What will happen to the mental health building on Spruce Street? Do we have any plans for that? Will it be demolished, sold?
As of right now, we do understand future needs and understand there may be a use for it. As of right now, we have nothing planned to do anything with the current building in its current status.
Because right now it's empty, if I'm correct.
Did you say Olathe Mental Health?
No.
Yeah, Olathe Mental Health. It's being
It is
utilized.
being utilized right
Okay,
now,
I'm
yes.
sorry. For some reason,
Yes.
I was thinking it wasn't being used. Then, looking at these diagrams, will there be a shared reception area for mental health and public health? Will all people come into the same reception area? And
Yeah, I can answer that question. Some of those details will come out a little bit more in schematic design phase, right? We're mostly in space programming phase right now. However, it is envisioned to have a shared lobby in the building. There was a goal that was expressed by staff to not have a delineation between the health services and make sure that all are welcome to use the building, and the building embraces that equally. So although they might have clerical separation in terms of check-in, there is envisioned to be a central entrance and central lobby.
oh, that's great. Appreciate that. And then finally, I guess this is more a question for Tim DeWeese, is having mental health excuse me, services in the same building with the public health services, how does that help with our CCBHC requirements? Is there going to be some efficiencies there, or some immediate access to the physical health component of that?
Tim DeWeese, Mental Health, it would actually absolutely provide some opportunities for us to take a look at that and be able to look at any options that we could do to be able to build upon any primary care evaluation and services that we're providing. So, and we actually already do some of that, both within the current location, but also in the Northeast office, because we're co-located there as well.
Or, yeah, it just seems like a good opportunity to
Absolutely it is.
those efficiencies. So thank you.
Commissioner Allen Brand.
Thank you, Mr. Chair. Well, first of all, thank you all. This is what I call detailed work, complete work, and that we have a chance to review it. And even though sometimes the dollar amount is kind of hard to swallow, you did the due diligence. So I appreciate you looking at other, like Mayo Clinic, and looking at some of those others. So it seems like you took that into consideration. And I do agree with Commissioner O'Hara, that building that was built in 1997, and me being in the industry, that building, just the details in that building, it is a money pit. And so we need to get over that money pit. I mean, I know I went through it, being in the industry myself, and I felt like some of the code guidelines were not efficient. And then to me, that's where, the commissioners voted against the staff. And that, again, is why we have professional people advising us of what to do. So to me, it is a money pit, and we have to move on. I'm also, that you took the time and the due diligence of the months that you put into this study. I also appreciate that you're looking at also growth. I heard a lot of the participants from Olathe, and services are going to be needed in Gardner because you look at the shift of growth between Spring Hill, Gardner, DeSoto, and the needs there. So that is also, I think, very important. Did I hear this right? You have over 18,400 DHE client, okay. Wow. And that's at the Olathe location. I'm sorry. We could get up.
Again, Charlie Hunt Health and Environment, so that's the total between Olathe and Mission. However, most of those are in Olathe. As many of you are aware, our Mission Clinic is open on a limited basis, just 2 days a week at present.
Well, and I appreciate all the services that you provide. It's just not about vaccines, it's about everything else you provide, health and wellness and all those as well. And I know it's over 30 million. And did I hear that, that's the money part, so I'm off base. Anyway, thank you for putting this together. Very, very good job. Do you have questions?
Go ahead, Commissioner Ashcraft.
I'm sorry.
I don't know if I cut. I saw you, you're a better door than a window.
It doesn't matter.
Go ahead.
Okay, well, I'll go then.
Please, thank you.
Well, one of the concerns, DHE Mission, you're only open 2 days a week. I continue to get complaints. You weren't fully staffed all during the pandemic, and so I always get back when I get a constituent complaint, were they willing to go to Olathe? They're not. They, either they didn't get vaccinated, they didn't get tested, or, and large number of the services are to Medicaid people, so they don't have a lot of options. And that's a real concern to me is staffing, and we're having this large Olathe presence, and we need a larger Northeast. And so and then when you look at transit at Olathe, it's awful. Transit is great for the mental health at Shawnee and Mission. It's right on a bus stop. And so my main point is Northeast people who are low income, dependent on transit, or live in that neighborhood are not going to go to DHE or mental health in Olathe. And so I've seen how budgets work, so we have 113,000 in Olathe, and then what will happen in that Northeast Service Center? I would like to see the drivers, the license tag pulled out, and that being a mental health, public health facility right on the transit line. And so I guess my first question to you is how you're going to deal with staffing. We have a building in Northeast that you haven't been able to staff.
Sure. And thank you, Commissioner. So you are correct. We've not been able to fully open the Mission Clinic back up. Earlier this year, we opened back up a couple days a week after having suspended services up there during COVID. We're still down a couple of nurses. The compensation increases that you all provided to us have helped to some degree. We're in the process of recruiting for additional nursing staff, for example. But keep in mind that it does take more than just nursing staff. In order for us to fully staff that Mission Clinic, we need not only nursing staff, we need a nurse practitioner up there, we need lab staff, we need customer service staff. And so we are committed to continuing to look at ways to do that. I know that we're going to have a meeting with you next week, and we'll be able to go into this in a little bit more detail to go over the challenges that we have with doing that. But all I can say is we are committed to exploring ways to provide more services up in Mission. But at this time, it is a challenge with the staffing levels that we have. So we'll look forward to speaking with you more about it.
And I guess my second thing is transit really, if we're going to build $113 million, we've got to look at integrating transit. Transit is awful to that building. And, there's not a lot of jobs in that area. There's not a lot of affordable housing in that area. At Mission and Shawnee, we have just a lot of affordable options. And the city of Mission, there's a huge new apartment complex going up that there's going to be market rate and affordable, so it's the walkability for staff and clients. My other concern for facilities is what, we've done with, the 911 emergency center. We built it larger to meet growth, and we have the empty rooms. We did this courthouse. We got a lot of empty space. We have, it's not the morgue,
Medical exam.
yeah, half that building is empty. So we build the Johnson County ways, we build large buildings with a lot of extra space for growth. And then it just sits there and and it could be 2 decades, 3 decades before we move in. And so for this building, and maybe Tim can answer, I just don't want to see all this empty space when we have all these mental health needs. I don't know if we could contract it out to another mental health provider. What is your thoughts, Tim? I don't want to see, all these empty rooms, when we have needs that will be empty rooms sitting there for 2 decades, like we see in these other county buildings. Do you think that's what's going to be the case?
So I can't speak to any empty buildings because we
Well,
filled
not those
every
buildings,
room.
but in
We
terms
filled
of-
every room in all 3 of our facilities with staff. So in fact, we've moved some out so that we could make room for more and move them into the first floor here. So there's 100 staff downstairs in this building now. I just want to say that the Shawnee and the Northeast office, from the mental health perspective, we will continue to provide full service mental health services at both of those locations. This building for us is really replace a 1962 building that we moved in 1981. And we've used every nook and cranny for programming and for staff. That's what we need. So from a standpoint of growth, yeah, there's a little bit of growth, but that's why I wanted to focus on my slide that when we talk about growth from the mental health center, we need to think about growth in its entirety. So yeah, we're going to have growth in the Northeast, and I think we have availability to do that as we can move some things around. Shawnee, the same thing. We're actually adding on in Shawnee. Open a clinic in Gardner, which I would like to hopefully have that done in 2024. That would also relieve some things. So we're talking about that as a whole, but when we're focusing on growth within this facility from the mental health perspective, we are only focusing on that growth that we envision for mental health in Olathe, not mental health in the entirety.
That 40% number is 40% growth for a lake.
No, that 40% was the total amount for the mental health center over from 18 to 2023. However, if you looked at the column before that, if you spread that out, and we talked about this last week, is that if you go back to 2008, we were up near 520 FTEs. We dipped down. We're on our way back up. So our actual growth has only been about 11% since 2010, I think is what the slide says. I usually refer to 28, but I think that, or 08, but that's 2010. So it's 11%. So we see the growth, but we have to see the growth across all of our county because we're going to serve in all of those areas in our county just for the reasons that you expressed.
Commissioner Ashcraft?
Thank you, Mr. Chairman. Couple things, if I could. First of all, I want to thank you for talking about kind of the current environment and the future. You call it 3.0. I don't know why it's not 5.0 or 6.0, but yeah, I appreciate you at least trying to frame that. And I also appreciate and I asked this question yesterday and you touched upon it, the potential expandability of the facility. If that's not the right term, you understand what I'm saying. So that's good. I appreciate that thinking. I do have a few reservations and would probably need some more educating before next week or whenever this is scheduled to come back. Mr. Chairman, you pounced on the point, and I think it's appropriate about the cost of the facility and over the life cycle. Many times it's the cost of operating the facility and the importance of making sure we have state-of-the-art, efficient, responsible, and that makes a lot of sense. The hesitancy I have is, and you made reference, and if I'm understanding it correctly, to third-party certification, and I don't know what you call it, but the Bronze Award or the Platinum Award, and LEEDs, thank you. And I understand that, but there's an expense to that, and while I am very much in favor of having those efficiencies in there, the cost of the actual certification leaves me hesitant. So I just offer that as an observation. I did want to, though, build on or maybe expand on some of Commissioner Fast's observations. And Mr. DeWeese, you kind of filled this in, but I'd like to learn more because, and I'll say it because Joe Waters is probably the only one here that was in this meeting a few years ago on the courthouse, and he won't be here much longer. So I'm not trying to get rid of you, George. George. Whoever you are.
Already forgotten his name.
Yeah.
Jeez.
You're out now.
When the courthouse was coming to fruition, we had a meeting in the basement, and one of the questions that I raised was, well, before we go off on this great expenditure of $300 million or whatever it was, have we fully leveraged the use of technology in the court system, video court, video arraignment, and so forth? And you would have thought I had insulted someone's mother. The judges jumped on me saying, oh, we can't do that. We got to look them in the eye. This is the way it's always been done. No, you can't do it. And then COVID hit, and lo and behold, they started doing it. And some say they actually enjoy that more. They benefit more from working remotely, including the attorneys, particularly the younger attorneys. So along those lines, I'm just wondering, in your 3.0 model, and I see some of it, but I'd like to learn more about how you weighed and measured and considered the centralized versus decentralized services versus mobile services versus teleservices. And Mr. Hunt, your predecessor and I had an extensive conversation about mobile services, especially for populations that are in need. To Commissioner Fast's point, not having transportation options, not even having awareness of the services that they could benefit from. And I don't see that because, like Commissioner O'Hare, 113 million, it's not a courthouse, but it's a nice price tag. So thank you, Mr. Chair.
Thank you. I don't know if there's any response to that. One thing that I do want to note that I was impressed by is the pre-design study and the work and the number of people that went into that. Having, I think, 181 professionals put time and effort into that. And it seems to me that there was already a lot of VE, and maybe that's not the right term, but right sizing, collaboration, and taking down the square footage of this to 150 from, I think, over 190 at some point. And so if we were talking about the price tag of that, we're talking about a lot more than 113 million. So I appreciate that those efforts have been considered. I did want to ask if the county manager or Mr. Connor or Mr. Barron or whoever can address the allegations of the buildings being too big and underutilized. Is that something somebody could address?
Yes, there's several in here that could address it. I know the courthouse was mentioned. I know Joe worked closely on that, so probably Joe Waters on that. There may be others that want to weigh in on several other facilities, but you kind of, yes, thank you for the opportunity to respond to that, as well as maintenance on the building that was built in 1996. I think staff you guys deserve to hear some response to that, so.
So I'll start. I would say, from my seat up here, and my seat that used to be downstairs in facilities, there has been a concerted effort to build for a certain amount of growth in expected needs in each department, or to rent space or to rebuild space with that in mind. Sometimes those projections are hit, sometimes they grow more quickly, sometimes they grow a little less so. I would say then the hit ratio is pretty darn good. The Emergency Communications Center has, I think, a little room left on the dispatch floor. We still have a lot of PSAPs in this community, and perhaps one day that the rest of that will be filled with those purposes. Otherwise, I think it's functionally full. The crime lab, I believe, is functionally full. The courthouse, I'm not real happy to say that the future build-out space that we thought would last 15 years lasted 5. So now that space is being finished out, as you all know. So it is an imperfect science, and that's why the Strategic Facilities Master Plan is updated pretty regularly, every 15 years or so, to try to make sure that the space and the assets we have are being utilized the best they can. Right now, after COVID and with remote work, there's still a lot of uncertainty. There's more space available right now, I would say, than we've had in the past. And however, I don't know how that's all going to play out yet. So,
On the medical examiner, not.
Right, the medical examiner is
a lot of space.
medical examiner is a unique one. You would certainly
Well,
not
and
want
the cities
to
haven't been
add.
willing to go into that space that we created at the 911 center, so it's been sitting there. There's a huge room empty.
Tony, do you want to address that?
Yes, Tony Barron, yes.
988s.
We right now, we are, the
Sorry.
988 Mental Health Call Center has moved into that space. We also are entertaining conversations with their department about look for more room on the floor
But it
itself.
was empty for 5 to 10 years now, right?
That would be correct. It's just right now, we're filling it up. That is correct.
Commissioner Myers, did you have a question?
Thank you, Chair. I just wanted to get clarification. Commissioner Ashcraft, your hesitancy is on LEED certification?
The expense of the certification process, not the actual improvements. The cost-benefit analysis, many times, if not all the time, is verified, but that LEED certification used to be rather expensive, hundreds of thousands of dollars. Maybe that's much less now, but that was the concern I had.
Okay, I just didn't want staff to get an idea that I thought it's extremely important for the building to be LEED certified in some manner, and the more the better if it's, again, cost effective. But I think LEED certification is expected now with our new buildings.
I would agree with that. And again, I think going through the process and utilizing that LEED standard and working with the professionals, the U.S. Green Building Council and otherwise, make sure that the building we're building will stand the test of time, that will be efficient, that will be healthy. And this being a collaboration of 3 different health-related departments, making this the healthiest building possible, is overall going to be in our long-term, not only social but economic favor. So I appreciate the work towards LEED certification, and agree that we should look towards the highest one that is obtainable with this facility. We've been at this for over an hour now, so I want to move on to the fiscal component.
I still have, this is questions.
I appreciate that.
It's a $113 million allocation. We
Which is
should
why
take the time.
And we are, but I want to focus I want to focus the conversation at this point on the budget and the revision to the budget. Can you, and I know Robin talked a little bit about the sourcing for this. You had talked about utilizing 93.5 million for debt. Can can you help me understand how we came to that number as opposed to the whole 113, or just keeping it at 83?
Yes, when we approached the increase, we thought it would be best to look at it from an ongoing and a one-time. In our sense, this is a one-time increase change to the project budget. And so we knew by looking at the one-time sources that we had that capacity to use it for this project. And then we also knew without having to increase any additional ad valorem or ongoing expense, that we could reallocate the existing debt service that we have budgeted for the video court CIP and put it towards this project. So by utilizing both the ongoing shift of the debt service and then the one-time funds, then that leaves us at really a zero increase to any ad valorem ongoing impact.
No, I appreciate that. Let me open this to questions on that funding plan. Commissioner Ashcraft, go ahead.
Thank you, Mr. Chairman. Besides, the suggestion about the Public Safety Sales Tax 3 makes a lot of sense. Sharpen your pen and keep looking, though. I mean, that's good. Just to clarify, the one-time use of the countywide support funds for $10 million, that's my beloved COVID tax rebate money, isn't it?
That is the funding that is within the general fund, yes, of the countywide support funds, not the SLFRF that is designated and has to be spent and has requirements.
Thank you.
Commissioner Allenbrand?
Thank you, Mr. Chair. And so it meets all the requirements to use that money for this building, correct?
Which funding?
The COVID money?
The countywide support fund, that is what the revenue recapture that has been moved to the general fund, and so we have that ability to spend that. Yes.
Got it.
That was money that was ran through the sheriff's office.
Recouping additional public service salaries, right?
Correct, public safety salaries, which was
Correct.
an allowable revenue recapture.
That was where it was money laundered. Okay.
It was both sheriff and Med Act as well.
Fully in compliance with the Department of Treasury.
Correct.
Well, some money laundering is legal.
Thank you very much. Further questions regarding the financing?
I do.
Commissioner Allenbrand?
I know I have a question, I just lost my train of thought. I do think that the price of this and what it used to be when you had a lead building, I think that's important to to utilize that here, because it's different than back in the days when I was building. There was a huge cost factor. Now there's more savings in electricity and what you're putting into it, so I appreciate that work. So that makes sense to me.
Commissioner O'Hara?
Thank you, Mr. Chairman. Okay. Walk me through the sales tax, public safety sales tax 3.
The public safety sales tax 3, it was approved for the courthouse and the medical examiner facility. And the video court, in a sense, is an extension of courtroom and court work. And so we've checked with legal, and that is an allowable expense under that.
That's $670,000
of debt service. Again, that project initially was brought forward at $8 million. We had the sheriff and the facilities department go back. They're reviewing that. They'll have their proposal back here in probably March or April for the budget, and they'll give us any revised projections that they may have. So we're hoping the $8 million should be the max of any one-time use, and then hopefully it'll be less than that.
Okay, so we're talking about financing the sheriff's video court while we're talking about the building that we want to build, the 154,000 square foot building on Sunset, right?
No.
Yes, we were looking for, again, funding options for the increased cost. In this, we've talked with the sheriff, it makes sense. We have public safety sales tax 3. We can use that one-time additional revenue to fund the video court, and then we can reallocate that budgeted annual debt service that we have in our projections and use that for the health services building.
Okay. So basically, we're going to be using the public safety sales tax, which I had been seeking to pay the bonds off early so that our folks in Johnson County could have a decrease in sales tax. Maybe some people would like to have a little tax relief. But now we're going to use the $8 million to pay for the video court, so that we can shift that money over and put in the pot money for the mental health, public health building over on Sunset. Is that correct?
Yes.
Okay. So kiss that goodbye, the idea of reducing sales tax, which I realize the cities would have been screaming about because they get 30% of that sales tax. So when does that sunset?
Just to
Can we go back real quick, because I don't think that was
No, I want-
correct.
right,
I
when
want a
does this-
clarification. Thank you, Mr. Connor. It's not $8 million.
So basically, I think what Robin is saying is we're taking the video court project, which was going to be debt-funded, making it a cash-funded project using Public Safety Sales Tax 3.
Correct.
You've budgeted the amount, which is the general fund amount, not Public Safety Sales Tax 3, to use that debt authority and put it toward the health services building.
Right. Yeah.
So just to be clear, the debt service is not part of Public Safety Sales Tax 3.
But there's going to be $8 million.
That is the proposed amount right now. They're going back and looking at that. And just to clarify on Public Safety Sales Tax 3, to end that, it would have to go out for a public vote. We would only be able to pay those bonds off early by, I believe, 1 year at the most. And yes, you're correct. The cities have already, they knew they had that funding through the end of that time frame, so they have already went out, debited projects, and they're assuming that revenue to come through to help pay off their own debt financing.
But when does that
For those
end?
projects for the approved sales
When does
tax
that sunset?
Through the end of the time frame, March 2027.
March 2027. Okay, thank you.
So if you recall, the item that was brought forward regarding video service at $8 million was substantially reduced to $1 million to try to do a Phase 1 study. And even in continued conversations with the sheriff's office, they agree that that $8 million number was unsubstantiated, and the amount that we'll end up spending on those video services will be significantly less. And which I appreciate that we're going to be able to utilize a little bit of bandwidth elsewhere instead of rubber stamping an $8 million project that wasn't fully flushed out. Commissioner Fast.
I want to go back to, it's going to be 150 square feet, and so how much will we use when we move into that building? How much of that 150 square feet will be used?
I think I can speak to that. So day one, we do plan to utilize the entire facility. The growth that's built in will be built in through flexibility of space and flexibility of design.
Thank you. That's what I've never got. I thought we were adding 40%.
No, there
That
won't
was
be
my
there won't be vacant or
concern.
shelled space in the facility. We are just strategically designing
So,
space to
well,
be
we're
flexible.
using it all, and then
Exactly.
you're going to.
We can, yeah.
So I might have a large cubicle. In 5 years, I have a small cubicle. Is that what you're saying?
And in addition to that, we also look at master planning the facility for additions in the future. So not only are we building in flexibility within the walls of what will be constructed day one, but we look at the site plan to see how we might be able to add on to it in new construction in the future.
And what are you doing with the Wick Garden? It says that's preserved or not preserved?
It is preserved, and
All of
actually
it?
it is, and the
Yay.
new site plan also allows for it to be expanded.
Okay, thank you. I'm not, and Robin, so the whole debt servicing, can you explain that more? And then how much, just like when I take a loan for, I have a mortgage and then I pay on that every year. So of that 113 million, how much
will be
debt, and then how much do we pay, and what's our interest rate, which increases our debt each year? And how much does that go into ad valorem? I guess there's 4 levels.
Correct. So we would plan to issue debt in the fall of 2024, and then the debt service payments would begin in 2025. We would issue debt currently at $93.5 million. That's the proposed plan, and that would equate to an annual debt service of $7.5 million. And so we currently have the $6.8 million budgeted for the original project amount, And then again, we would be reallocating the $670,000 of debt service for the video court CIP. And then that would equate to the $7.5 million that we already have budgeted for 2025. So it would be no increase to the ongoing impact to the county. The interest rate that we're currently using is 4% for our estimates.
So no increase in ad valorem payments
Correct.
to be able to expand the scope
Right.
and given if we choose to utilize the one-time funding.
Correct.
To be able to buy down that overall cost of debt. Commissioner O'Hara.
Thank you. Well, if we didn't have the $7.5 million in debt, what is it, $18 million per mill?
14.6.
14, so that's a half a mill.
Correct. A little
It's a
under
half a mill. Yes, if we don't
A little
have
over
it.
half a mil, sorry.
This is going to increase our expenditures by half a mil.
It's already budgeted, right?
Correct. It's in our projections, yes.
Well, you can dream that it's budgeted, but you don't know your revenue stream yet. So, and if you didn't have this cost, that would give us room to reduce the mill levy. So, dream on.
If you don't want to provide any services, you don't have to have any mill levy. But the idea is we're here to provide the services to the people of Johnson County.
I understand that, but I think
And there's a
that-
cost to it. And our job is to measure what those costs of those services are, and as a policy-level board, set those policies that would encumber certain expenses from the taxpayer to then provide those services. And I appreciate that the services in mental health, in aging, in the Department of Health and Environment are worthy investments to me. And so I, again, want to make sure that we are able to provide those good services, which over time, I think will save money for our county. And that's the key, penny wise, pound foolish. We could lower the mill by half a mil and not be able to provide these enhanced services for the future of our county. But I want to look more than 1 year into the future. I want to look at the long-term health of the people of Johnson County. And we have to invest in that if we're going to remain one of the best counties in the nation. Commissioner Allenbrand?
Thank you, Mr. Chair. And some I just need clarification on. So this was something that we've already had budgeted. It's the surprises that we have that cause us heartburn. So I appreciate the work you've done there. And I too, and this is kind of off, but along with Commissioner Fass, I too have heartburn over transit. At least you have transit. I don't have it, and I just got it cut. So again, that's another whole topic, because I have all kinds of areas of pocket where that would work. But again, that's another huge cost that's not, that we don't have. And I do want to say that I know some of the anxiety over the shots that were at Mission had to do with not enough COVID vaccines, and it was everywhere. So I did help a couple of people, because Walgreens had some, and so did CVS. So if you want to take those, you can get it. I'm still waiting on one for me, just because of having the supply. And Mr. Connor, maybe Mr. Waters, but I know Mike already has you gone. But so my question is, I thought the last part of the courthouse was just built out. There was no more space.
I think
So
that's
did
what-
I lose? Did I misunderstand
That's
that?
what Tony had mentioned. I think there was some space that was projected 5 or 10 years
Right.
out, but then when the state made their decision to add judges, that space went away.
So we built it. Yeah, that's what I thought. So it was really actually ahead of schedule. So I just wanted to share that with
The
Commissioner.
unprogrammed.
It's not, a lot of it's not being used. Ask the judges.
Anyway.
Well, I did want to make a comment and tongue-in-cheek to Commissioner Ashcraft, as a young attorney, or at least I somewhat consider myself young.
Well, you're younger
At
than
least
me.
in company here. Tongue-in-cheek. I love going to the courthouse. I love arguing at the courthouse, and I would much prefer it to video court. So I had to give you some trouble on that. Commissioner
No, I don't
Hanslick?
mind that. It's
like
it's
going
just
to
the
the
staff. Yes, yes. I once had hair too, just remember that.
I do not remember that. Commissioner Hanslick?
Just to follow along with that too, I think.
No, you don't have to pile
No,
it.
I'm not, that while mental health care is we've had more telehealth services. There are things for which that you have to do it in person. You have to do medication assessments in person, that it's not possible to go to complete telehealth, particularly with mental health services. I just wanted to add that.
Appreciate it. Commissioner O'Hara?
Thank you, Mr. Chair. Well, I really respect how wastewater, they went through their process, and they were able to re-engineer their facility and cut a tremendous amount of cost. And I just think that it is incumbent upon us to perhaps ask the staff to go back, how can we be more efficient? And on the parking lot, that parking lot is like crumbling. I mean, so you're going to use the parking lot, but you're going to have to totally rebuild it. So basically, you're using the dirt. I mean, so it's compacted and all that good stuff. But that parking lot is falling apart. Is that correct? Yeah. Basically redone, except for the compaction. Yeah, okay. So I just think that we need to direct staff to go back and really analyze what our needs are, how we can be the most efficient, because this is a big price tag. And you're using, what, you're using $20 million, a little more than $20 million in cash to buy it down to see from 113 down to 93, so 20 million. So, we're using $20 million of cash.
Yep.
And that means that we have other needs that won't be financed, such as the park where the Coleman building is, or was. That was past tense.
Ms. Postoke Ferguson?
Yeah, so two things. There was a lot of value engineering. Perhaps we didn't highlight it as much as we should, because there are hours and hours, and I understand a lot of team members that put effort into it. The chairman mentioned earlier the 190-plus square feet, that they took it down to 100 and, what is it now? 150. And don't forget the inflationary factor either, because there was a placeholder. We disclosed that in the budget. We knew there was going to be an inflationary factor for 4 or 5 years of having a placeholder. But I would ask staff to highlight the value engineering a bit more, because if we didn't do that justice, there was a lot of work in that. Similar to, Tomahawk had a lot, Nelson had a lot of work in that as well, but they probably did highlight it a little bit more.
Yeah, I understand that, and I understand that we had to build in the escalators. And it's interesting to me that we identified and talk about the escalators that we have to put in for the increased cost. Yet when we're looking at a tax incentive on a industrial building, we're saying that that cost is only $67 a square foot, which is absolutely insane. And so this is $737 a square foot. You know, I go out and I look out on the average, which I understand that this is medical, is like $532 a square foot. But you're looking at leads and all of these other enhanced building costs. And I just think that we just need to look at this a little bit more closely. And I don't know, do we need to revisit our 480,000 square foot empty building that's sitting out in Gardner? I don't know. It's just, we don't have, our taxpayers are bleeding. Our property taxes are just, it is extremely burdensome for many, many people within our county.
So let me go back to Penny's point and ask if you wouldn't mind, again, maybe embellishing a little bit on the pre-design study and the work that's already gone in to trying to VE and to get this down to a space that, according to our directors, is going to be fully utilized upon day one.
I can start that answer, and if there's others that want to chime in, please do. As mentioned, when we gathered departments together, that program started at 194,000 square feet. And over the past 6 months, we've been actively working to reduce that number and find efficiencies, find opportunities where we can share spaces as much as possible, and utilize even other parts of existing county facilities to meet needs for these departments where they're located elsewhere. So I do think that has certainly occurred over the study. I would also offer that, keep in mind, we're in pre-design phase, right? So we're still early in the project, certainly earlier than Nelson is with their project in wastewater. So there's opportunity for us through schematic and design development to continue to find efficiencies, and I thoroughly expect us to do that.
Anybody else? Yeah, go ahead, sir.
Yeah, John Garr again. I think that, as I mentioned earlier on, we did work hard to benchmark and look at the private sector versus the public sector and how we deliver the services in the medical realm, looking at patient counts and patient throughput and things like that. Without putting Todd on the hook, is Todd available to join us? He would be excellent to maybe talk a little bit about some of the spaces.
I'm not sure if Todd Accardi.
Yes, John, I'm here.
Oh,
Yeah,
hi, Todd.
great, Todd. Hey, thanks. Would you mind giving your name and just talking a little bit about some of those exercises that we went through regarding sort of the patient waiting, the patient rooms, and the process and the office spaces to reduce that quantity down?
Sure. My name is Todd Accardi. I'm an architect and senior medical planner with Perkins & Will. So over the course of several workshops, working with my partner, Dr. Debbie Beck, who's also on the line, we started with the requested spaces that the various teams had kind of brought to the table, and then we worked with them, not only looking at their current throughput and volumes of patients, but also their anticipated throughput. And then we benchmarked them against various different peer institutions, some that were mentioned, like the Kaisers and Mayo, but we also benchmarked them against other very similar institutions, public health and public mental health facilities, to kind of further fine-tune their revenue-generating spaces, the exam rooms, the consult rooms, the therapy rooms, but also kind of benchmark the workplace strategy spaces. What warrants a private office versus what warrants a shared workroom versus open workspaces. And that's also how you then started to see that trend line of the overall space start to trend down, because we weren't necessarily cutting spaces. We were refining the size and how they were used and how they were shared. So we're still seeing the same amount of patients. In fact, we're probably seeing more patients over that trend line, but how we're utilizing that space becomes more efficient.
Thank you all. Appreciate that. I wanted to also talk, just bringing back real quick to the timeline when we're talking about cost here. This was originally a creation in and around 2020. I think there's only 3 of us on the dais that were here at that time. But the direction shifted to look at 600 New Century Parkway. And then eventually the direction 2 years later shifted back not to look at New Century Parkway. And so there's been about 4 years now where the direction has shifted, and that delay, would you agree with me, during that time, even on the original footprint, that the cost has increased pretty significantly, just based on the industry and commodities, correct? So, go ahead. You wanna
Yes,
address?
sir. Tony Barron. Thank you, Mr. Chair, for addressing that. Yes, right now, of course, escalation through COVID was unpredictable. And yes, that price has gone up. Currently, as we stand, based on 2 major contractors in the Kansas City market, we're looking at roughly 1.5 to 1.79 inflation/escalation per quarter right now. And so that number is holding steady. But I say that from this fact of, yes, this was put on hold. Inflation has caused it to go up in price. It is going up as we speak today. And just want to make sure that we understand that no pressure in a decision by any means. You guys we'll take that. But yes, escalation is a factor in waiting for this, but also doing the due diligence to study it was also worth the time also.
Well, I can appreciate the silver lining, though, in that, but at the same time, continued delay and going back to the drawing board, no pun intended, is not free. There is a cost to then the overall project budget if we're going to try to obtain the same project, and the costs and inflation continues to grow, and none of us have a crystal ball as to what inflation and interest rates and everything are going to do, or maybe we'd be in a different line of work. But there is a cost to inaction that we also need to figure in this as well. Commissioner Ellenbrand?
Thank you, Mr. Chair, and I understand about the property tax. I hate the property tax. There's nothing I can do about the property taxes, but what we can do is reduce the mill. But this is a project before I was sitting here that people were looking at, and I look at the professionals setting out here, and I respect what you've been doing and the services you've been providing. And I'm sure Commissioner Myers and Jeff Stewart will shame me for saying this, but, you know, they have, to put the money into the Coleman property, which would, you know, be a park or whatever that is, I feel like the money needs to be invested here. There's other opportunities on parks. You know, we've got all kinds of business opportunities where we can partnership there. This, to me, is important. This is saving people's lives. This is providing services that are needed in Johnson County now. And the more that you continue to keep project engineering, the cost is just going to go up. I'm hearing some now where some of the construction say that some of it's coming back down. Maybe you'll be lucky and that will happen. But you know, this is a study session. This is important. And no, what?
We're in the committee of the whole.
Oh, committee of the whole. Thank you for that. You know, you're younger. I'm a little bit older, so I get a little slack.
That's why I'm helping you.
Oh my God. I appreciate it. I appreciate it. So anyway, I appreciate all the work you've done, and I'm just looking, you know, not to keep you out, Tony or Joe, but I look at those three gentlemen back there, and I see what they've done to our community just in the last couple years that I've been here. So thank you.
Commissioner Ashcraft, Commissioner Hanslick.
Thank you, Mr. Chair. Mr. Chair, I just wanted to offer to Commissioner O'Hara, I don't disagree with your assertions, but before I'm willing to send it back, I would like to, in this coming week, better understand this 3.0 and the service delivery models that you delved into. There were some hints here. I'd like to understand how far you've gone. And I'm sorry, I'm burdened by Joe Waters and the courthouse, and I'm not blaming Joe Waters, but there was a lot of conversation there, because that's a big issue for me. And I would say the question about, what do you call that building out at New Century?
600 New Century Park.
Yeah, the corn cob building. You know, we've kind of been back and forth, but the environment has changed in terms of whether to use it or not to use it. $130 million price tag definitely makes me think maybe a little differently about that facility. And maybe it doesn't work. I'm not saying it does, but I just want to understand all the components as best I can before I commit one way or the other to this.
Commissioner Hanslick.
Thank you, Mr. Chair. It seems like we've done a lot of talking about this, and at this point, I am ready to make a motion to direct staff to request BOCC approval and authorization of the project budget increase of $30 million to bring the new total project budget to $113.5 million, and also to direct staff to request PBC approval and adoption of resolution to authorize the sale of bonds in February of 2024.
I'll second that. Commissioner O'Hara.
Oh, thank you, Mr. Chair. Well, I just want to remind the commission that we have, approximately at least $2 million a year that on cost of maintaining the new CenturyLink building. That's $2 million a year that we're spending. And then the cost of building, or if we decide to tear that building down, we also have that cost. So, I mean, that is an albatross, and that is an example of economic development, that was, the panacea, that was going to just be wonderful and is going to create all these jobs and this, that, and the other. And now we have the albatross sitting out there nobody wants. And, if there is some way that we could turn this into, take the coal and turn it into a diamond, that would be great. And I'm choking on this $113 million price tag. And if there is some way, because, that's 154,000 square feet, which is approximately a third of that building out there. And so, do we need to look at that again? I don't know. But I do think that at least we should, ask the question, because that is an expense that is going to go on and on and on and on. We're going to have to make a decision at some point.
I'm sorry, Ms. Postock Ferguson?
So in response to that, and I'll look for others to help me here, but we had asked for approval of this project, and it was discussed 4 or 5 years ago. Then the board said, hold on that, go study New Century. We did that. We brought it to the board. It delayed this project for 2 or 3 years. We got a decision from the board, so it's a policy choice, but the last policy choice and direction given to us was to not consider that. And so then we went back to the drawing board and resumed these steps that brought us here today on this. Meanwhile, that cost us several years of inflationary costs. So the question to the board, it's a policy choice. If you want us to pause again, know that there'll be additional costs. And we've got buildings that are falling apart. So it's no easy thing to go back and look. And if that's what the will of the board is, we can. But we're following board direction right now.
I understand. And I respect that. But we didn't have a $113 million price tag that we were looking at. And plus, we have a contract that we have to honor until 2027. So there was not just the design aspect. It was that we are not going to be able to tear that building down until a specific date because of Evergreen. And I guess that is, what, in 2025?
We're talking about different buildings.
Yeah.
So, anyway, Commissioner Fast has been patient.
Yeah, I just have I just can't highlight, I'm representing my district, how important that mission office is for public health, mental health. And do we have, I don't know who can answer my question, in our CIP to address the growth in Northeast Johnson County in that building? Is there anything budgeted for that building right now? Because I would like to see something.
I'll look to Robin. I don't think that's in the next year's capital plan.
I mean, it's such a, I see all the time people getting off the bus going to that building, and it is such a critical location.
And Tony actually may be able to answer that.
Yes, Tony Barron. Yes, in our strategic facilities master plan, we do have, within the next 5 years, something to look at that. It's probably in terms of a study. I don't know the details right now, just not being familiar with that 3,000-page document yet.
So mental health could expand with that funding in there.
It's basically yes, it's in the outlook to take a look at in a manner of working with Department of Health and Environment, others involved in that building on what does that look like. I see it being something similar to what we have done with HSB, just on a smaller scale. Identify needs,
So to
identify programs.
clarify, the study is funded or in the CIP. It's not, they're saying the study's not funded. So that's a future policy choice.
So would that be up to get into CSP, or CIP?
Yeah, so it's something that we are currently forecasting in out years for the budget, but not in the 2024 or 2025 budget.
Correct. That project or that piece probably will be coming back for CIP, and they'll be looking at where to place that in the future years.
Okay, well, I'm advocating for that. I have one more. The COVID funds, we haven't even talked about how we allocate it. I would really like next week that we talk about the COVID funds. I am just not comfortable about putting 10,000 of COVID funds. We've allocated 10 million, yeah. But because we have allocated 4 to 6 million for home repair, which I've been bringing up for like 5 years now, and we're down to 22 million. I think that conversation needs to be had before we say 10 million goes from that fund, and I would ask that to be on the agenda next week.
Commissioner Allen Bray.
I want to move back to what we're here for, and I do appreciate the county manager bringing up about the New Century building, because some of us, there was a no vote to use that building, so now this is, where we're at. So can I just call the question?
You can. Is there a second?
Second.
Okay. The motion is on the table from the direction of staff as made by Commissioner Hanslick. Would the clerk call the roll?
To bring it back.
To bring it back.
Next week for a vote.
Yeah, on the two pieces of direction per Commissioner Hanslick's motion. As stated on the screen, Mr. Connor.
Now we got 9 of them.
Date certain to bring it back.
The motion did not have a date certain, but if it's okay with a friendly amendment, can we bring it back next week?
I have a friendly amendment
thanks.
too then. I would like us to review our countywide support funds prior to allocating 10 million to this.
Ms. Symes?
One thing that I would like to mention or elaborate on with this is a proposed funding. I think, and I don't want to overstep my bounds, but I think we feel comfortable that we can fund this increase. If the discussion wants to occur later, because I know we talked about bringing forward some funding options for that piece in the near future during the budget process or in the spring, I think we feel confident and comfortable that we can fund this increase. If a decision is made to switch that 10 million of CSF, then we will look for other sources within the budget, or if there's a reduction, whatever that shift is. But I feel comfortable that with the proposal, we can move forward. My concern is, again, extending. If we don't move forward next week, then you're extending the project. You could obviously incur additional costs.
Okay. Process question, Commissioner Ashcraft.
Well, Ms. Symes may have just answered it. Next week is just going to be hellacious, and this is an important topic which is complicated. I was wondering about, and I hate to wait until after the holidays, but any opportunity to move any of those items off next week, because they're important decisions, I'd like to make sure they're thoroughly debated.
I appreciate that, and why I understand that, and we'll have an agenda review here in a minute to talk about next week. This item does have some exigency to it, and while we can discuss the CSF as part of this, I don't think I don't need a presentation or a verbose report about CSF as part of this, because as Ms. Symes stated, that this is looking to authorize the budget increase as well as scheduling the PBC approval. And some things are still fungible within there. So, Commissioner Myers, did you have another question? The question has been called, but do you have a procedural question?
I just wanted to get this on record because I held back trying to think about time, but if it's going to be talked about, I want to be on record saying I think the CFS funding is most appropriate in this situation. And so I wanted to say that earlier. I didn't because of time, but I think it's most appropriate.
Okay. With that, would the clerk please call the roll?
Sure.
What are we voting on? I'm sorry.
We're voting on what's on the screen to be brought back next week.
Okay.
Chairman, can I say one more thing about CSF?
Go ahead.
Because it's directly, I think, what some are struggling with and what Commissioner Fast brought up. So the way it's laid out here, there's 22 million currently. The 10 million, if we needed it for this, would leave 12 million in there. And we are working on a plan to come back to talk about things like the weatherization and other things that would be appropriate to come from there. But we still have 12 million that we plan to bring in the coming months. So that is still a plan. It's still under works. It's also how can we staff it and make it work so that we can spend the money appropriately and timely, et cetera.
The clerk please call the roll.
Commissioner Fast.
Aye.
Commissioner Myers?
Myers, aye.
Commissioner O'Hara?
No.
Commissioner Hanslick?
Hanslick, aye.
Commissioner Ashcraft?
Yes.
Commissioner Allenbrand?
Allenbrand, aye.
And Chairman Kelly.
Aye, 6 votes in favor, 1 against. Is that consistent with your count?
That is correct.
Okay, thank you very much to the staff. Appreciate your patience. We're going to take a 5-minute break, and we'll be back at 3:20. Thank you all
Sheriff.
very much.
I will need 10 minutes to
Well-
switch technology.
We'll be back at 3:25. Thank you very much.